Hi, I'm Kendra Shae-Marie Mullings, and this is Pan-African Pulse. Coming up on today's show, we will be destigmatizing health barriers to the ACB communities with CAYR Community Connections. Stay tuned to Pan-African Pulse. Welcome back to Pan-African Pulse. I'm your host, Kendra Shae-Marie Mullings. On today's show, I have two team members from CAYR Community Connections, and we're going to be destigmatizing health barriers in the ACB communities. With me today, I have Shanice Harris and Derek Kawisa. Welcome to the show. Thank you so much for being here.
Thank you for having us today.
You're so welcome. So, Shanice, can you tell me about CAYR? CAYR
Yes.
Community Connections as a whole, as an organization.
Yes, our organization has various programs that we offer. We're located at Young and Davis Drive in Newmarket. The programs that we offer are, we have a Rainbow Space, a Hep C program, harm reduction education program. We have HIV support services, and we also have, did I say the Hep C program as well. We also have a community pantry that is open Tuesday through Thursday as our office days. That is available for community members to come and seek any food supplies, pantry items that they might need at home. Sometimes we have support for mothers, so diapers or bottles and stuff like that, as well as access to safe sex supplies and other items that might be in the pantry. Clothing donations sometimes we have to support the community in various ways, and each program collectively works together to make sure that all community members are reached, as well as community organizations as well.
That's amazing. That's a very, very wide and large umbrella.
Yes.
It's so necessary in the community. And what is your specific role at CAYR?
So I'm the Women's Health Coordinator. I support women living with HIV and AIDS, as well as I run the Moms Group, which is made up of 25 women who are living with HIV or AIDS. And it's called the Moms Group, but really it just means any caregiver, anyone who's in a caregiver role that needs that extra support, whether that's filling out documents for ODSP, finding Toronto or York Region subsidy for childcare. We also offer practical assistance every month to these moms and events as well to support them, to give them that social inclusiveness as well in their journey, and just make sure that they're connected in any way possible through my role. As well as I'm the Y coordinator. So the Y is an initiative funded through the province, which stands for Women's and HIV and AIDS Initiative. So that has 6 priority populations that we try to support and outreach to and include in our social outreach. Those 6 priorities include ACB women, Indigenous women, trans women, women impacted by gender-based violence, sex workers, and women incarcerated. And from there, we just create the conversation to grow bigger in the community to make sure that the education is continuing to understand what HIV looks like for women and femme-identifying as well.
That is absolutely amazing. And I think it's so important, what you said there, to make that distinction when we're creating outreach for mothers, that it's for everyone who mothers, right? Not just someone who has given birth. That's important too. But mothering is a wide spectrum. It's a large spectrum.
Sure.
So I think it's so awesome that you include that. And Derek, what is your role at CAYR?
My name is Derek Kawisa. I am the Program Coordinator, Multicultural HIV Prevention. I basically run presentations in the community on HIV prevention, support self-testing kits, education, and conversations around that, info sessions to organizations, carrying out outreach, talking about HIV, conversations that folks do not know in the community.
So you're going out to organizations specifically, or is it, do you go to families as well, or is it just other organizations?
Other organizations and then outreach, for example, like newcomers community, welcome centers, and churches as well.
Amazing. Churches as well. That's really
as
great.
well. Yeah, because I mean, there's HIV conversations that people do not talk about it, or they think it's not okay to talk about it. Yet in real life, so my role is to sensitize that
Yeah.
to the community.
I think that's so amazing that you're able to go into churches and talk about HIV.
Yeah, of course.
It speaks to how far we've come in
Yeah.
our world, as a society.
Yeah.
Are many of the people, Shanice, that you serve at CAYR from the Georgina area?
Not necessarily. So we support anyone across York Region, and if everyone knows York Region, it goes from east to west, north to south. So as far as steels and moving even a little bit outward, as long as they're on the border to our catchment area, we can support them. We do outreach in Vaughan, we do outreach in Richmond Hill, we do outreach in Markham, we come all the way up to Georgina.
So you do offer programs here
Yeah.
in Georgina.
Yeah, we come to the outreach at the Georgina Food Pantry
Okay.
and the link there. We try to hold our testing drives there as well because we have to make sure that we reach everybody and not just secluding it to our home base, which is a Newmarket. And we also go to King, the Seneca campus that was there. We do sometimes get invited to do education outreach there. So we kind of dabble in all the areas that York Region has to offer.
That's so amazing because a lot of times when, in my experience anyway, when programs are rolled out, a lot of times I find Georgina is often forgotten. So I
Yeah.
love to hear that you come up here and you have programs that happen up here. Is there anything happening up here in Georgina this month or in the upcoming future that we should know about?
Yes, February 13th, we're going to have our testing drive, our Hep C testing drive. And it is ran by the Hep C program, but it offers testing for any sexual health concerns that anybody might have, even just as simple as connecting with someone, a nurse from public health, or getting more information about what Hep C is. That will be at the Georgina link on February 13th. And there will also be swag bags provided there, food, and any conversation that anyone might need to know what Hep C is, or just take that away and keep it in their back pocket if they have any concerns moving forward in the future as well.
It's such a wonderful thing to have in the community where people can have a safe space to go and discuss things that it might not be easy to discuss
Yeah.
anywhere else. Coming back to you, Derek, you are the program coordinator for multicultural HIV prevention and
Yep.
care,
Yep.
right? And you spoke about going to organizations
Yep.
to kind of educate and speak about that. Now, is there a difference between HIV and AIDS?
Well, there's no different, you could say, because HIV is human immunodeficiency virus, and then HIV is the first stage
Okay.
of when you're diagnosed. It's a first stage that that you face, and
That's
then
the initial
yes,
diagnosis.
yeah. So,
Okay.
but AIDS is the last stage, where the T cells are dead, and your body cells is literally not in fit to fight any diseases that may
So
come
it's at a
along there.
terminal stage
Yeah, that's
when it's
like
AIDS.
yeah, that's like the final stage where most of your organs are all gone. So they're different. Having HIV doesn't mean like you are at that stage where your life is no more or it's
So the
almost ending.
difference is treatable versus terminal.
Yes.
Okay. And can HIV be cured?
Apparently, no. Of course, research is underway, to find the cure, but we deal with it in different ways. Once diagnosed early, there are, treatments that can be given, and then somebody is able to live a long life with it, with no, any diseases that may lead to AIDS.
And how common is HIV today?
Well, it is common because worldwide, according to World Health Organization, there are 38.4 million people.
38.4 million
Million people living with HIV. And here in Canada, we have about 60,000 people living with HIV.
60,000 people
In Canada. That's of 2021 study was taken. And then in Ontario, we have 31 people living with that is 31,000
31,000
Yes,
people
people
in
living,
Ontario.
yes, living with HIV. And of course, like cases rise every other day. So that study was taken in
So
2021
these are
as well.
2021 studies. And
Yes.
would you happen to know the stat on that for the York Region area?
Well, I haven't like known about that, but of course, according to CAYR, like
Yeah.
you know, that's the work we do. We you know we see the rise. So
Yeah.
we see the rise. I can say the rise is alarming. Like it's something that needs attention. So literally, HIV is still rampant and it's a concern. It's a worldwide concern to everybody. It's still happening, even here in York Region, because we are stationed in York Region, and the services that we offer them to folks living in York Region. So,
So it's here.
so it's here, precisely.
It's here. Wow. You know, when you think about it, I think a lot of us think of it as being something from the past, something from the late 70s, 80s, and 90s. It kind of went underground to mainstream folks, right? Where it's not a part of our daily lives. We're not talking about it. So you're involved in this work. So you're seeing it on a
Yeah.
daily basis and seeing
Yeah.
that it is a concern right across our communities in York Region, including Georgina, you would say,
Of course,
right?
yeah.
Wow.
And if I can just add, just us alone at CAYR, we see over 200
Yeah.
members in our HIV support services.
Yeah.
So that just adds a little bit of the numbers or statistics that could be prevalent in York Region with
Yeah.
us supporting those 200 individuals plus.
So it gives us an idea of what a concern it is in our community and how it should be a concern for all of us.
Yeah.
Wow. I'm sorry, I'm just taking a minute to kind of absorb that information.
Yeah.
It really is jarring to think that you see 200 people just in this area alone. Like I'm really processing
Yeah.
processing that.
Yeah.
And those are 200 that know their
Yeah.
status.
Yeah.
Yeah.
So think about the people who face stigma and getting tested or
We'll
taking that
we'll
step.
come back to that in just a moment as I'm processing. We'll be back in just a few minutes for this discussion on Pan-African Pulse. Don't go away. Welcome back to Pan-African Pulse. I'm your host, Kendra Shae-Marie Mullings. Today we're destigmatizing health barriers in the ACB communities with two team members from CAYR Community Connections. I have Shanice Harris here with me and Derek Kawisa, and we have been diving deep. And we left off talking about HIV in the community, and they kind of, if you guys can believe it, left me a little bit speechless. Realizing what the numbers are, not just in Canada, but in Ontario and even further in York Region, and the fact that they're serving people in our communities, as this is something that we don't tend to talk about. So I want to come back to you, Derek, and I want to ask you, what are some of the HIV prevention challenges that our community members face?
Thanks. Number one challenge for sure is a mental, like thinking the ideas we have about HIV. One, it's not, people think HIV is for ACB community. You know what I mean?
Yeah.
It's
ACB meaning African,
Caribbean,
Caribbean, Black.
Yeah.
So the number one challenge you're saying is that the general population seems to think that this is the community,
Yeah.
that the only community that has HIV.
Yeah, of course.
Wow.
Yeah, but when you think about it, it's like it's not true, because 60,000 folks in Canada infected with HIV are not like Black people only. So it's one thing. People do not adhere to these, measures or
Yeah.
conversations around it, and thinking, okay, it's not about us. It's
Yeah.
the other community.
It's not my problem.
Yeah,
I'm
it's
not
not my
affected.
problem. I'm
Right.
not infected, but they're like every community. It's I mean, it's a worldwide pandemic.
It is.
So
Right?
it's one problem.
I think a lot of people think that it's gone away, that it doesn't exist
Yeah,
anymore.
yeah. And well, they say, according to World Health Organization, they say by 2030 there should be like we should not have HIV worldwide. But I'm telling you, it's not even 10%
Wow.
a deal to reach that goal. So it's
We're
still,
not on pace
we are
as
not.
a global community to reach that goal.
Absolutely, we're not. And another way of, again, people like don't think about it. People worry about STIs, pregnancies and all that, than HIV itself.
And that's what I'm saying, as someone who's a part of the general population, and I consider myself to kind of stay up on what's happening in the world and in my community, even I still had the mindset that it's not as prevalent as it once was, let's say in the 90s or 80s,
Yeah.
right? So it's important that you're letting us know that it's here, it's happening right here in our communities.
Yeah, of course.
What are the most effective HIV prevention methods?
Self-testing kits. It's one thing that I've been promoting.
Did you say self-testing?
Yeah,
That's
HIV.
available?
Yeah, we have self-testing kits.
I had no idea.
Yeah, and we at CAYR, that's one, in support services, HIV support services, it's one of our crucial, goal, to sensitize the community, even individuals, like other organizations, on how it works.
Do
Yeah,
you think it's widely known that that's available? Because I didn't know that personally, and it could just be me, but like,
exactly. Not according to, the outreaches and then the presentations that we've had, it looks like not many people know that actually we have self-testing kit,
Yeah.
which works with then less than 5 minutes. You already know your results. So it's
wow, I had no idea.
it happens, and we give them out. We every outreach that we go out to, mostly in York region, it's like our mandate to carry them along, to talk about them.
And it creates privacy
Of course.
around testing and safety
And
around
it-
testing.
Yeah, and it comes with whole information, what you're gonna do once you test positive, what are the procedures that you're gonna, I even like just knowing about it, it's important. Like knowing about HIV self-testing kit, even if you're not diagnosed or something. So that way, if we pass on that information, someone may, I mean, we have conversations. People, can have sex with someone and they're not sure of their status. So it's okay to tell somebody, you know what, I think you're gonna have to run a test if you,
Or even before
or
you
even
cross
before.
that boundary. Well, what a
Yeah.
great thing to have available in
Yeah.
the world, and to have available. Now, where would you get something like this? Could it only be received from an organization, an outreach organization like CAYR? Or where would something like this be available?
Truthfully, CAYR Community Connections is the only organization that really supplies like large number of HIV testing kits in York region, which is why our HIV support services is a busy program, because like we have, as you know, like this York region is really big. So but we try to sensitize the community about it. Every outreach that we carry out, be it harm reduction
So it's
outreach,
not something you can go and grab at the drugstore or anything like that.
it could be there, but of course, as you know, it may not be just given out to you just anyhow or something.
And then
also.
that whole idea of someone walking into
Yeah,
to purchase the safety, the privacy
Yeah.
issue. So CAYR is a place where this is accessible and available in a
Absolutely.
safe space.
Absolutely, yeah, and we can always like once you call us, we can find a way of reaching out to you, because we serve people where they are at. We find them where we. It's our mandate to reach out to the community, not the community to reach out to us.
Yeah.
But we make sure that we reach out to our community.
So
Yeah.
that's a wonderful thing, and I had no idea that that was available. This has been a great learning experience for me, and it's wonderful because I can share this information that I've
Yeah.
learned from you here today. Shanice, are more women affected by HIV than men, to the best of your knowledge? Or in your experience, are you seeing more women?
I can say that just in my role, I do support more women clients or service users. But this could also mean some moms or women or femme-identifying individuals might have already been diagnosed where they're immigrating from or moving from different location to here, versus it just being them finding out their status when they
Right.
come here. So that could be
That could be the reason. So it's hard.
argument on either
It's hard to
side.
gauge.
Yeah.
Yeah. Why do we still know so little about women's health in general, do you think?
I mean, I could talk about this all day, but for sure, what I can say is the lack of offering funding to support those data collection and needs assessments in the communities, from micro level all the way to a macro level. Nonprofit organizations try their best. At least in our knowledge, we try to do needs assessment, whether that's through focus groups or surveys, to see what we can do as an organization to
But it
support.
needs to be bigger than that. It needs to go
Yes.
higher than that. We're not paying attention
No,
to women.
there's not enough testing done. Even if you go onto the Ontario website, it shows that breast cancer, for an instance, there's not enough knowledge or research done to share the statistics for women in the ACB community, which is the African Caribbean Black. But if you offer the space for these studies to be done, you would be able to retain that data. But
Yeah.
that step needs to be done for
But
that
again,
to
it
happen.
comes back to it's not affecting me and my
Exactly.
community. It's not my concern.
Exactly.
We're not going to fund
Yeah.
this particular thing. What are some of the social factors affecting women's health in York Region, you would say?
For sure, I think it's the accessibility, being able to travel from one place to another. Our locations for community support are very much stagnant in the support. If you go downtown Toronto, everything is all in one area. In the
We're
York
so
region,
spread out.
exactly, it's
So
hard to access
location,
that.
and then of course other social factors of like income,
Yeah,
accessibility, like
language,
you said, language barriers.
and just that common history of trauma from healthcare, from like our
Yes.
history that we share from our ancestors and
Not
our
wanting to go see a
disclose
doctor
or
or
being
whatever it
taken
is.
seriously when we do disclose something.
Yeah.
That all adds a factor into how we access care from woman to woman and support each other in that journey.
And how would you say that women's health impacts the greater community in just a few words?
I think it would be able to be accessed and talked about across the board, if that information was given from a woman's standpoint, because we support so many areas of work that continuous conversation can keep going on and on and on versus just in one specific area like healthcare. It could
Exactly.
be in educational
It
systems.
needs to be a much wider, deeper conversation. What would you like York Region, specifically York Region's Black community, to know about women's health, and how can we support the work that you do in just about a minute or so?
I think what I would like the York region to know is that just because the title is women's health doesn't mean you're excused or not encompassed to the women's health. Women impact the community as a whole in any regard. So just being mindful that the way that you support one part could actually be a rippling effect to the other. So just keep that in mind as you do your work and as
And
community
women's health
leaders.
shouldn't always have to be activism and
Exactly.
advocacy.
Exactly.
It's about us all. And what can we do to support the work that you do? In a little, just a few words.
I mean, if I can ask community members if they ever have anything that's they no longer need or are not using, we're always accepting donations at CAYR.
Amazing.
And a lot of moms are suffering with the economic changes that we are seeing, so just supporting in any way
Anything
as
that
you
you
can.
have to offer, you can get in
Yes.
contact. And Derek, what would you like to say to York Region's Black community specifically about HIV? What do you want us to know in just a few words?
Yeah, well, most importantly is to know that HIV still exists.
Yes.
and then let's not run away from going for healthcare, assistance.
Yeah.
We can always, there's always a way out. So if do not stop going to a hospital because of, certain barriers which take place.
Seek help.
Seek
right?
help.
Talk
and
about it.
Yeah, talk about it, and then we're here. You can as well reach out to us because
And how do we support the work that you're doing?
generally, as Shani says, we run. For example, we run a
We,
pantry.
we can donate to you, right?
Yeah,
And
we
we
can
can
donate
find
to
that
us.
on the website.
Yeah, and for example, let me use actually this platform to say, even for HIV self-testing kits, whether it's like whoever that responsibility is for to provide them, they're still needed because we see them in your region. At one point,
Thank you
we lack
so
that,
much,
yeah.
Derek. I'm sorry to cut you off. We've come to the end of our program. We could have go on with this discussion all day long. Thank you so much for joining us. I'm Kendra Shae-Marie Mullings, and this has been Pan-African Pulse.